This presentation is brought to you by the Beljanski Foundation. Over 50 years of research towards curing cancer the natural way.
We've been sitting for a while, so everybody stand up for a sec. If you don't mind, just give a little stand up for me. Thanks. Stretch your legs a little bit. Get your body shaking out. Perfect. Perfect. So I'm going to ask everybody a question. Who here has a loved one that has been plagued and passed from cancer? I'd like you to sit down if you have. Please. Thank you. Who here has a loved one that's been plagued with and passed with heart disease or heart attack? Folks, look around. Not many people standing, right? When is enough enough? Thank you. You sit. That's why I'm here today. I'm here to share with you how to minimize the chances of you being plagued by some of those diseases and other things that you might not know is connected to the spine and your nervous system. Most people think chiropractic is just a back and neck pain profession. So if you don't have a back or neck pain, why go to a chiropractor? Well, I'm going to share with you today, my goal today is not to just inform you of this information, but really to transform you. I don't want you to leave saying, hey, that was a great talk, very entertaining, very energized. I want you to leave today with a little more information because I find information is power, and power gives you the knowledge to be able to make the best decisions with your health. Who here wants to make better health decisions? That's why you're here today, right? Everybody, that's great. Well, I want to share something that I've come across through my own healing and through thousands of patients we've worked with. It's called a neurostructural connection. Neuro means nerve, as you can imagine, neurologist, neuropathic pain, neuropathy. That's a nerve type situation, correct? We all knew that, right? And of course, we know structural is the framework of the body. The bones in the body that control and regulate all of the function of the body. Encased in that nervous system is the brain. And the brain controls all the messages that come through that spine. And that spinal cord that goes out to all the cells, tissues, and organs in your body. So when someone says to me, how does cracking a neck get rid of asthma? It's really kind of a little confusing because it's not to treat, cure, or fix. I always say you treat carpets, you cure bacon, and you fix your cat. But in our office, what we try to do is help to tap into your ideal potential by freeing that pressure that's in your spine. Now, some of you have experienced that cracking sound, and some of you might be like, chiropractic. But I want to share with you that there's many ways to adjust or remove that interference from the brain to the rest of the spine. And today I want to share with you a story of little Johnny. Johnny was unfortunately born with the size of a tumor, the size of a baseball in his intestines. He was a really sick boy. His mom actually couldn't have him 4 years earlier because she went through Europe on a vacation and felt a pop in her low back. This pop affected her ability to have her cycle. So she became amenorrheic or didn't get her cycle, her menstrual cycle. She went to all the medical doctors. They wanted to give her all these medications in order to get her cycle back. Unfortunately, none of those really worked. But she went to her sister's chiropractor, and the chiropractor, within a month, got her back to regular. And 1 year later, the daughter was born, and the godfather, guess who it was? The chiropractor. So 4 years later, that son was born with a baseball-sized tumor, and thank God for modern medicine. Took that tumor out, resectioned about 12 feet of his small and large intestines, resectioned them together, but he was very sick. He developed horrible things like bronchial asthma, allergies, digestive issues, chronic ear infections, colds, sinus problems. He was on antibiotics over antibiotics and never really breathing right. You could hear him in the other room. At 4 years old, his mom knew where he was at all times because he could hear like Darth Vader, he was breathing. After a while, she said, this isn't right. She brought him to the ENT, and guess what happened? He needed to get his tonsils out, adenoids out, tubes drilled into his ears, more medications. He had all that done, and guess what? He was still sick. He still was on medications. He had a little bit less sore throats, but he still had the sinus issues. Mom never knew about milk or dairy. She didn't know about getting the boy adjusted by a chiropractor. Now we ask, what does adjusting a neck or a spine have to do with the sinuses? Well, we know that as you can see from the neuroorganic connection over there, each level of the spine is related to different organ systems, including the sinus system, or even the digestive system, like heartburn and reflux, or even the elimination system with colitis, irritable bowel. Now, I might be hitting some of the topics that you or your loved ones or little nieces or nephews or grandkids might be having asthma issues. And it doesn't mean one adjustment just makes it go away. But little Anthony came to our office, and when he got adjusted, he actually, within 3 adjustments, he was able to get rid of all of his asthma. And his mom was amazed because he coughed up all that Epidural, all this pink phlegmy mucus, and he was able to go back to playing soccer and enjoy his life. That's what we want for all of our patients, but not just you, because some of you here, we're preaching to the choir. I know a lot of you already are doing great things for your health. But some of you don't know that it's not just taking a pill, potion, or a lotion that's going to make you better. It's an inside job. Back to little Johnny, he kept on going through this problem all the way up to his teenage years. The tubes kept on getting drilled into his ears in a young age, and each time they drilled it in, the tubes would reject out. At 9 years old, he had the option to be able to get that tube surgery done in the office of an ENT with no anesthesia. Because every time he get anesthesia, he would get so sick and nauseous. So they held him down at his will because he said he wanted to not get the sickness from the anesthesia, and they drilled those tubes into his ears. The pain was horrific. He almost broke his mom's hand squeezing it so hard at 9 years old. And he suffered hard because the fact is, only a few weeks later, those tubes would pop out of his ears again, only to have to go back to the doctor and said it didn't work, it wasn't successful. Then as he started getting into sports and athletics and martial arts, he started developing bronchial asthma and allergies. And he was on Seldane and Theodore that now have been changed to different names like Allegra and Claritin. So they just changed the names, but the truth is they don't get to the cause of the problem. And that's why you're here today, because you want to find out the root cause of where your body is not at full potential. So back to little Johnny, the good news about Johnny is this, is Johnny's talking to you today. I was that little guy. That's my why. That's why I'm here. I don't want any more little Johnnies or Marys or Grandma Millies like my grandma. I don't want anybody to have to suffer unnecessarily. I'm not here to inspire you. I'm here to pull on that part of you that knows something's not right. Something's not right. That's why you're here today. It's not right. It's not working. Another drug, a pill, potion, or lotion from the outside in isn't going to make this body work better. In emergency situations, are we blessed? Yes, it saves our lives. But after that, where's the healing come from? The outside or the inside, folks? It's a participatory process. Inside, great, awesome. So another concept that I want to share with you, besides all the organs connected to all the cells, tissues, and organs of the body, is that if you have a misalignment of the bones, the bone will press on the delicate tissue. Most people think this delicate tissue being pinched on is painful. Only in 10% of the cases do you feel a misalignment of the bone called a subluxation. It's a big word for misalignment. Like dentists deal with cavities, we deal with subluxations. So when a bone presses on the nerve, you could have that. The lucky ones have the pain down the arm into the fingertips. The lucky ones have the sciatic pain or the pain up into the head, radiating, giving you a headache. Because you're motivated then, right? Because when do we take care of ourselves? When we get crisis, right? So we want to try to be more proactive. To this group, it's better to take care of things. An ounce of prevention is worth what, folks? Pound of cure, right? But a lot of times if it's not broke, don't fix it is the philosophy, right? But that's not working. That's an antiquated philosophy. And I challenge everybody in this room, and I'm sure, again, preaching to the choir, to leave that philosophy behind you. But again, this subluxation or pinched nerve, 90% of the time can affect the function of the organ systems in the body without any pain. So a little infant could have colic. A little boy could have asthma or sinus and allergy issues or constipation. Anybody constipated before? Don't raise your hand, but we know that's not fun, right? Nobody's happy to be around a constipated person, right? And nobody wants to be constipated. So the point is, by removing the interference, by freeing that energy up, the body has the ability to what, folks? Heal itself, right? So it's your body's ability to heal itself. We just remove the interference so the potential of your body can work at its full. So again, most of the time we treat the disease or symptoms, as you see over there, at the tip of the iceberg. And most of the time, that's where medicine is great at trying to mask the symptom. Getting the epidural shot, getting even the physical therapy, or even the carpal tunnel surgery when it didn't work because it was coming from your neck and they didn't tell you that. Because the discs that are herniated in your neck were actually causing the numbness and tingling in your finger. Or the epidural shot that you had in your back actually nicked the nerve and you just don't have the right movements anymore, or you're just not right in that area anymore. A lot of my moms who've been epiduraled because of pregnancy, just their spines are just not right after that. And when you pierce into that spinal cord area and put a needle right there, and then you put fluid in there, it blocks the energy from the brain to the rest of the body. And we don't realize it because it's subtle. We think it has to happen right away. It can take years to develop. People are like, oh, I had a car accident 20 years ago. Guess what? It's connected to you today. I'll tell you a story about a woman who came to me. She had a wicked car accident. Head went into the windshield. She banged her hand horribly, and she had horrible bruise, fractured her hand and everything. 10 years later, she was coming to me. She said, I had this accident, but it was many years ago. I don't think it's connected at all. I said, well, we'll see how that goes. We started adjusting her, and guess what came out on her hand? I didn't even touch her hand. The bruise. The bruise. Our bodies remember everything, unfortunately, right? Fortunately, right? Good memories, but sometimes not so good, right? Physical traumas are in your body. Emotional traumas we already know are, right? I'm not here to help you with that. But I'll tell you, I just had a testimonial just the other day. A woman came to me. She said, I've been in physical pain for so long that it's been affecting my relationship with my husband. My kids, I don't have the energy, the stamina to play with them and enjoy them. Things were gray. My life wasn't at its full potential. You started adjusting me, and I'm not tooting my own horn, but this is chiropractic. This is the natural way of healing from the inside out. She's like, I'm loving my life again. Things are colored again. I can taste food differently. I can enjoy the time with my children. I'm not snapping at my husband as much. We're connecting more, if you know what I mean. How exciting is that, right? So I want you to realize that you don't realize, maybe the person next to you might realize, how much it's affecting you, the pain or suffering that you might be going through. Or maybe it's not about your pain and suffering because you don't feel it, but the potential that you're living up to might not be its maximum. Who here stand up if you feel like you're living at your 100% potential? Like there's no room for improvement. 100% potential, please stand up. I'm the only one standing? Oh, yes. Okay. The truth is, the doctor is who? Not me. I'm here to tap into the doctor within you, to change your life, to help you reach your maximum optimal health. But if I keep on working on the tip of the iceberg and we don't work on what's underneath, the physical, chemical, and emotional disconnections, not just the foods we eat. We have some amazing teachers here this weekend talking about the foods we eat. And I believe that's probably 75, 80%. But you know what? Good food with a nervous system that is not digesting that food properly and assimilating it into the right energy isn't going to be as good and as healthy for you as somebody who's in alignment. Anybody look down at their phone all day long like this? Anybody sitting? I see everybody over here like this sitting. There's a new disease. It's called tech neck and sitting disease. You can look it up. Sitting is the new smoking. It is. It's horrible for your body. Not just your discs compressing, but the organ and the function of your body. Not just the fact that your neck is forward, but the research says that the more forward your neck, the less your health. There was a Nobel Prize winner, Dr. Alfred Brigg. He did the research back in the 80s, and he found out that the more curved your neck is the opposite way. Normal is a banana-shaped curve. Let me see if I can get to that. Yep, a banana-shaped curve. Let me get to that. Yeah, so that's the one. So a banana-shaped curve is normal for you. If you lose that curve, every degree of loss decreases your health that percent. And what you might have seen back there, which was not probably pretty to look at, but it will show you that we did have somebody who was, you can see the forward head posture and how that affects the body. So every inch forward is another 10 pounds of force. So if our heads are 10, 12 pounds, every inch forward is another 10 to 15 pounds. So you can imagine the compression, not just in your low back, but in your nervous system. Because up here, everybody touch the top part of your neck. Let me know if it's tender. Shake your head if it's tender. If you feel the base of your skull, any tenderness. Don't be that gentle. Get in there. You can feel some knots and tenderness in there. It's not just muscles. The bones themselves are out of alignment. That's this area of the spine here. If you come off the top of your head, right in the back, you feel this big old knot in the middle. That's the second bone in your neck called C2, or the axis. That's where all the rotation in your neck occurs. If that's out of alignment, that's going to put pressure on your brainstem and squeeze the life energy off. So my job as a chiropractor is to free that energy up. And it's not always done forcefully. It's done from the inside out. So by just doing a slight force or a specific force, no guesswork in our office. In our office, we like to approach things from a more scientific basis with a big heart attached to it. So it's not just mechanical, but it's also neurological. So we actually do tests in the office. Neuro scans. Imitation's the biggest flattery. You see that? So you see, we have different ways of consulting, not just through our hands, but through a thorough consultation that's intuitive and connected. But there's also postural analysis to check your alignment, which we have actually at the booth. So all of you can come by and get yourself posture checked. Then also we do a bilateral assessment to check the equilibrium between left and right sides, which tells us how your brain's functioning. So more weight, 10, 15, 20, 30 pounds, tells us we're out of balance, just like the alignment of a car. And then, of course, the computerized scan shows the inflammation and will detect how severe that's somebody who just subluxated themselves. So when the bone goes out of alignment, it presses on the nerve and it will show up on the scan. And of course, chiropractic x-rays, which are specific to you. So we don't guess. We don't pop and pray and rack and crack in our office. We're specific to what your body needs. We customize the plan for you. And that's why I'm here today. Because the worst thing for me to do is just to share information with you that doesn't inspire you to do something different. My calling is to be able to share this with the world. Someday, hopefully, you'll see me as the Tony Robbins of healthcare, to be able to share this bigger picture that the spine is related to everything. And everybody from little to old and everybody in between should be getting their spine checked proactively before there's pain. That's called spinal chiropractic adjustments. So it's an absolute pleasure. I look forward to working with each one of you that choose. And if you have any other questions, I'll be in the back to share. Thank you.